When is dribbling normal? It's an interesting question because I think for many people they think that dribbling is saliva. It's basically saliva management. It's normal for saliva to come out of the mouth when a child's teething. It's not uncommon to have more saliva being produced, but what we're really looking for is that the correct swallow pattern, the mature swallow pattern, enables the child to manage the saliva and swallow it rather than it coming out of their mouth. So that's more what we really want to look at. And when is that age appropriate? Well, any time from the mature swallow pattern is really quite functional from about 10 months of age. Some of the signs that they may not be managing that would be that the dribble's coming out and they have a lot of wet bibs when they're feeding. They're very messy with their eating. And if they're bottle feeding, or they often have milk around their mouth, they don't get a good clearance when their swallow is what we call immature and the tongue's thrusting forward. And one of the most common things we find with that is a forward tongue thrust posture, and that will happen often when they're using a gummy or a pacifier, because the tongue is sitting low and it often will create a gap between the front teeth, and the tongue then starts to thrust through that. So it makes it harder for them to manage the saliva, because that requires the tongue because there's a gap in the teeth, the tongue's thrusting through. And mouth breathing is the other thing that'll often, if the mouth's open, then the saliva's more likely to come out than if they're nose breathing all the time and the lips are together. You can see it in older age groups, particularly when there has been a prolonged use of pacifiers and bottles, when there has been, it's a sign that there's oral dysfunction. That's when, if you see that in a 3 and a 4-year-old, that there's still dribbling and drooling going on, then that's a sign they really need to be working with someone to help retrain that oral function, because by that stage they really should be swallowing all that saliva. The munchee can be a great tool to help re-educate those imbalances and dysfunctions that are occurring orally, particularly things like lip competence. If the lips have a bit of weakness, that orbicularis oris muscle is weak, then the munchee can be a great way of strengthening the lip muscle, and also for reinforcing that swallow pattern, which ideally the tongue should go to the roof of the mouth, and this posterior part of the tongue and the throat should activate when you swallow. When they have the dysfunctional pattern, the tongue's thrusting forward. So when you have a munchee in your mouth, you cannot thrust your tongue forward because the munchee stops it. So it's a great way of retraining that pattern and reinforcing the nose breathing if they're in a mouth breathing pattern. So yeah, it's a fantastic tool. So it's definitely one of the signs that your child could benefit from a munchee.